The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
There are certain things in life that we need in order, and when other parts of our life are all over the place, we don't have answers, or we're unsure, or we have physical things going on that we don't know how to manage, we try to take control in other areas, and a lot of times that can become OCD. I'm going to reorganize. Oh, I don't know what to do with this. I don't know where to channel all my energy. I'm going to go clean this or organize that, or whatever the obsessive compulsive concern is or behavior is. That's usually where that comes from.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Good morning, America. It is time to wake up. This is the Unplugged Healthcast, and I am your host, Dr. Kevin Wall. We have been in a pharmaceutical stupor for way too long. It's time to wake up. Stop taking the blue pill. Today, we are excited to have you with us, and we have got an amazing show and a lineup that I believe is going to bring a lot of value and clarity for a lot of people. We are tackling a difficult topic today that is a bit of an epidemic in today's society, and it is depression. You know, I know that something doesn't want us to produce this show today because we have had every technical difficulty possible. So we're excited to bring this to you today. I've got an amazing professor, a doctor of psychology, that's going to help shed some light on us. If you've never been on the Unplugged Healthcast, you know, we are bringing solutions and clarity where big pharma has created so much confusion. Chronic illness has really taken our country into the pandemic state of every day, meaning that we have people chronically ill. 60% plus Americans have one or more chronic illness at any one given moment, and that's not okay. So we're looking for logical, more functional solutions, non-pharmaceutical answers to actually help people get out of these things. And today we are going to dig into a topic that has really created a lot of concerns for a lot of people. So, all right, well, let's do this. We're going to bring in our guest here. Her name is Dr. Patricia Chase. I've known Doc for a long time here, and she is an amazing source. She is at one point I know was a licensed professional counselor for many years, but not just a counselor, because I know you counseled people who counseled people.
Yes. And
oversaw a lot of conditions and cases and counselors, and you weren't really okay with that being enough, and you decided, hey, I'm going to dig deeper and get my PhD in functional performance psychology. I think is close to that. Maybe you could bring the crowd up to speed on your credentials so they understand why I brought you on today.
Well, thank you first, Dr. Wall, for having me. I have to remember to speak into my microphone. First time podcaster. So I have been a licensed professional counselor for about 11 and a half years now. And like Dr. Wall said, I decided I wanted to do a little bit more, and I got my PhD in performance psychology. So a lot of people assume that it's associated with sports, hence performance. But really what it is about retraining your brain to be more productive. And that can be at work. It can be at home. It can be with life goals. It's just really honing in on, I have these behaviors that are not beneficial to me. I don't have my momentum for life. I don't have any motivation. I don't know where to go next, and retraining. And so it's like teaching an old dog new tricks, in some cases, doable, and you can be at your peak performance for yourself. Every individual has a different level of peak performance, and trying to hone in on that and figure that out to be the best version of yourself.
Well, that is exactly what America needs right now, because we are very confused, lost, and purpose is something that I think a lot of people know it should be there, but they don't really know how to find it again. So that's awesome. Thank you for helping and being part of this solution. Before we kind of get into our topic and trying to find solutions, we have a fun lineup for you today. And I would only say it's fun in the aspects that we're going to have some fun and do our best to laugh a little bit, cry a little bit, and see if we can't solve a few problems at the same time. We're gonna go over some just basics on depression, and I have some questions there. We have a live caller that's going to bring a condition completely unscripted. We're going to just see how we can handle it, see if we can bring some value. We have another conversation we're going to have, because I know your specialties in troubled teens or younger, the younger crew, younger population. Before we get going, we got to have a little fun.
Okay.
And most people don't know doctors are real people. Did you know doctors are actually real people?
I do.
Yes,
it's hard to believe, though.
it is.
Yeah. Well, because they hear that doctor title.
Yeah.
And they're automatically put on a pedestal and they don't get it. And I think in mental health, that's a big thing.
For sure. White coat syndrome is really, it's a real deal. And I know even when you get to the mental health thing, in fact, it used to be, and I think it's worthy talking for a second, is it used to be that if you had a mental health concern and you wanted to go to a doctor, you went into the office through the back door, right?
Yep.
You wouldn't want to, you can't be seen, and thankfully we've came a long way and you can enter in the front door, but it still doesn't mean they don't have a white coat syndrome and a concern. So let's see if we can help. We're going to speed round questions. You ready? It's fast, it's furious, and it's unscripted. So she has no idea what I'm asking her. So we're going to see how she does.
All right.
We'll start off simple one. Where'd you grow up?
I'm actually a native of Arizona. I grew up in North Phoenix and spent my days in the Scottsdale School District. And yeah, I went to college here.
Okay.
GCU, all 3 degrees. Go Lopes.
All right.
Yeah.
Well, I love that. There aren't many. It used to be a few more. Now you're growing crowd of the people actually are native by definition.
Yes.
My wife's one. I'm not. I'm an Iowa guy. So number 2, remember it's about you, not about me. So let's keep focused here. Number 2 is your favorite sport, food, or destination. And you can give us all 3 if you like.
Okay, so favorite sport right off the bat, hockey. If you know anything about me, my son played for like 11, 12 years. So watched a lot of hockey, grew up loving the Arizona Coyotes when they were here. Now I have season tickets to the ASU hockey games. So that's really fun. Favorite destination, Hawaii. Actually got to live there. Very blessed to live there for a year with my aunt and uncle.
Those are pretty good.
Okay.
We're going to move
All
on
right.
here. This one's one of my favorite. What is your superpower?
I think my superpower is my ability to be empathetic and relate to people on all levels.
Well, that surely comes in handy in your profession and position you're putting in a lot of there. So, all right. And last but surely not least, the most common, most redundant, most vital, reoccurring bit of advice you give to the typical patient, to most people. I bet there's one. What's the one nugget everybody could hear and listen and learn?
When deciding what to do just with anything in life, have realistic expectations of yourself and those people around you. If you have too high of an expectation on someone else that you don't really understand, it's going to cause a lot of emotional roller coasters for you. So really just be very realistic and honest. Like, does this make sense? And how do I relate this to my day to day?
All right. Great stuff. Okay. There you go. Speed round. Pretty simple. Not that harmful, was it? Yeah,
No, pretty easy.
I was trying to be nice.
You
All
don't
right.
have to be. Throw them at me.
Well, maybe it gets harder as we go. We still got a lot of show left. We're going to watch a quick video on a guy. I'm just going to call him Nick V. He's an Australian gentleman who was born with no arms, basically no legs.
When I was 10, that's when I actually attempted suicide. In 6 inches of water in my bathtub, I pretended that I'm just going to soak in there for a little bit for my back pain, and I was trying to drown myself. And as I was trying to inhale water, I was choking, and the thought of what that would leave for my parents actually stopped me. And by the mercy of God, I saw a visual of my mom and dad crying at my grave, wishing that they could have done something more. And that was the reason why I decided to stay. Because you don't know what beautiful things can come from your broken pieces until you give your broken pieces a chance. And so I'm so glad that God stopped me.
How does someone really come out of that deep of a hole of reasons to not move on? Because that is a question I've heard a lot, and really pull it out. But if I could, before you get to that one, which is when you look at this, I've noticed something. Depression is not a respecter of persons. You know what I mean by that? That it does not have a racial discriminatory male, female perspective. I mean, it can happen to all of us. And in fact, the reality that seems to be a common factor, and I don't know if you've seen these stats, but suicide in older white executive males is really, really high. There seems to be a correlation to abundance. The more abundance someone has, the more prone they could be to depression or suicide. In fact, if you go to third world nations, you'll find suicide almost doesn't exist. I'm not sure depression's a diagnosis in some of these areas because they're just trying to sustain daily life, and abundance isn't even a thought. So speak into maybe that. Well, why is this, and how can we have abundance and maybe not be depressed, or maybe give me your thoughts on any of those things?
So I think when it comes to abundance, we strive for that, especially in America, right? Because the more money we have, the more things we can do, the more we feel confident and comfortable in doing the things, right? We don't have to worry about paycheck to paycheck. We don't have to worry about these kinds of things. We can protect our kids. We can protect ourselves. We can have the things we've always wanted. However, I think in the pursuit of finding that abundance, we forget about the things that third world countries don't, the day to day. The enjoyment of the day to day. And I think in the older white executive male mentality, it's my goal is to do this, is to achieve this, and to excel at this. I don't think about who I am. I'm just a machine and I'm supposed to do this. And then if I can't achieve this, my wife will leave me. My kids will think I'm horrible. I'll be a total wreck. But they don't look at the day to day, the thankful, the grateful. I got up today. I have this roof over my head. I have a job. I have a wonderful family that I can spend time with, but we forget about focusing on our own internal happiness. And I think once we forget about our internal happiness, we just get too sidetracked with everything else. And then you forget. And then it becomes, like I said, a downward spiral of if I don't continue to achieve these things, then I'm just a failure. And then it's like, I can't do it anymore. There's nothing holding me back and I have to leave.
So it seems like maybe the higher the expectations we impose upon ourselves, the higher chance we're not going to meet some of them, or all of them, or half the time, many of them.
Right. And sometimes it's our own expectations. Sometimes it's parental expectations, right? Oh, I want you to, I came from another country and I'm giving you all these opportunities. I need you to be a doctor or a lawyer or take advantage, right? And so then kids get this internal stress. Now, some can manage it really well, right? They don't get depression. They don't get anxiety. It's kind of just the way they're wired. But then other kids, it's like they push and push and push and push, and then they burn out and they break down and they fall apart. And because as much as your parents are trying to support you to be the best version of yourself, they're pushing you to be the version that they want you to be, not who you necessarily are. And so then I think we just lose our sight of happiness. And, we talk about Heath Ledger, right? Prime example. He talked about, there's a quote that he has about, people will ask him all the time, what's it like to make money? How's it to have all these fancy houses and to travel all these places? He's like, nobody ever asked me if I was happy. And I think that's a thing that an American society forgets about.
Well, that would make sense. Thank you for sharing that insight. I've got a question that, is really maybe off the beaten path here, as we move past that video and just go to something that I struggle, because I've seen it, and it's not really a question I have in my mind, but a solution or a way to get people to understand it. And it goes like this. After 35 years of treating hundreds of thousands of patients, I can tell you that in easily 60% of all the patients, there is a physical problem that's often connecting or connected to or related to or a result of a mental issue, and it goes vice versa. Whereas a lot of people think somehow your depression has nothing to do with your headaches, or your depression has nothing to do with your digestive system, or your depression has nothing to do with your chronic knee pain, and there's so much. I mean, you guys all have to know that there are 200 medications out there today that actually have a side effect of depression or anxiety. And majority of those are medications for physical problems, pain medications, huge medication that has side effects of anxiety or depression. The statins, the cholesterol medications, those things are killing people. I'm sorry, but that's one of the bigger ones is depression and anxiety on that one. We can go down the list. Blood pressure medication, some actually strange enough, some of the Lexapro or some of the sleep medications or the anti-anxiety medications have depression as a side effect. So about the time we think we're dealing with something, we forget the fact that your body is one system and one thing is not disconnected from another. How do we get people to do that? You and I had one point work together in more of an integrated scenario to help people physically and mentally together. We still do it at a place called Mental Health Centers of America, where we work with people, psychologists, psychiatrists. We have physical health. We have hyperbaric chambers, red light therapy. There's ways to physically help people and mentally help them at the same time. But tell me your thoughts on that connection.
I think it's huge. I bring it into my practice the first session. People will talk about, I have these headaches and I get anxious and I go through this. And so I speak to the body. Where do you feel it? Right? Especially with kids, because a lot of times you can't express those emotions. And so my knee hurts or my stomach hurts or I have headaches or I don't sleep well, right? If you associate sleep and body aches and pains and your mental health, it's all connected. You can't just draw a line and close the door and say, nope, my depression is just because my brain is off, not because I have all these other things going on, right? And we keep trauma in our body. So people may have experienced trauma as a child or as an adult, and their hips hurt or they can't walk right. And then they're depressed because you can't do the things that you want to do. And then you've also got this trauma maybe you haven't dealt with. And so it just culminates.
As the name of our healthcast is the Unplugged Healthcast, one of the biggest syndromes that are out there is that even though people may grasp this, they go to a doctor or a therapist or a counselor or a psychologist or a psychiatrist, and they really don't look anymore in that comprehensive viewpoint. They come in, they see your condition, they give you a prescription, or they see your pain and they give you a pain treatment or something. But where can people go and how can people go and they can actually really have someone look at this from a more global standpoint? Are there places out there anymore? Are they around?
Where I used to work, Bayless used to be that way. It was very integrated. We had PCPs and psych and counselors, all on site, right? So if you were meeting with your PCP and you had chronic headaches and you were also depressed or experiencing anxiety, you'd get immediately passed off to a mental health person in order to sign you up to get you into counseling, to also correlate. And so we would be so integrated, kind of like what we were working on in the past of like, I'm going to talk to you, you were going to talk to me, we're going to work together as a team to figure out what's going on, right? Nowadays, it is a smaller percentage of groups. I mean, my goal with my company is to eventually get back to that because I think it's important. I push clients to talk to their PCPs and their psychiatrists.
If you're going to a facility and they don't understand the complexity of the systems working together, I would recommend you ask or change. We need to push and we need to prod and we need as consumers to start speaking into the problem, which is this system is broken. Just looking at your emotion and not looking at the physical or chemical or environmental components sometimes, where we got to stop just being specialists, because that's just been the trend for the last 50 years. Everyone specializes and there is no body part that just is running around. Everyone seen a foot just running down the road? Like it doesn't happen. Like it's connected to the knee bones, connected to, you remember the old story as a kid. So when you're looking for help, when you're looking for solutions, if you really want to get to the bottom of this, you can't disconnect yourself, and your doctors can't do it as well. So, all right. Well, we're going to come right back in a moment with one of our caller today, and we're going to see what's going on and see if we can help in some fashions. We'll see you in just a moment.
After an injury, it can feel like life's on hold, but at AFC, we're here to help you get back to what matters. With personalized injury plans and our expert staff, we don't just treat the pain, we guide you back to strength and confidence. Because getting back isn't just about healing, it's about thriving. Call us or visit our website to start your journey today.
I say often, and I just have to remind you, there's 4 principles that the Unplugged Healthcast really is based around. And I just want to remind people as we have this show, the 4 principles are simple. First one is health is more simple than you think it is. That we're making it way too complex. If you're a farmer, food, water, and sunlight, right?
Yep.
Yeah, that's it.
That's it.
And if you decide point 2 that you're going to bypass food, water, and sunlight and go with ibuprofen, Diet Coke, Prilosec, Lexapro, Taco Bell, any idea, Doc, what happens?
Oh, your insides are not happy with you.
Yeah, we're not producing healthy ferns. Number 3 is the doctor doesn't heal you. As much as I'd like to think I could heal you, or Dr. Chase thinks, we know we can't. You heal yourself. And so when you start doing things to exhibit healing, to increase healing responses versus suppress feelings, then you really got a chance. But most medications, most big pharma treatments out there are all in the aspect of suppressing something that's going on in the body.
Correct.
And we both know that ain't going to end in anything good. Long term, that's going to be bad. And number 4 is pain is not your problem. It is a red oil light. And when you go to the auto mechanic and he brings out this black spray paint, and would you keep going?
Yeah, I mean, you just know, like your body is going to respond to your emotional state before you even realize it. Crying, pain, stomach aches, fatigue, all those things. Those are signs that there's other stuff going on.
Yeah, and we got to be aware of the signs, and the signs are more functional than feeling, right?
Exactly.
Things aren't working, or you aren't sleeping. You're not handling. Your irritation levels are higher, right? Your fuse is short, and people are telling you. Look for those signs before you run into the catastrophes, right? Because if we stop being catastrophe-focused patients, then our doctors can stop being catastrophe-focused doctors. Because as much as I would throw a few rocks at some of the scenarios, they're doing their best, and we're walking in with the problems. We got to take responsibility, right? A little bit, at least some. All right. Well, we have got on the phone a young lady named May, and I think she's from Memphis. And as you all know, May is not her name. We are protecting her privacy, and I'm not sure she's from Memphis, but it sounds like a fun place to be. Have you ever been to Memphis, Doc?
No, I've been to Nashville.
Yeah,
not
Nashville's
Memphis. Memphis sounds fun though.
All right. Well, May, are you there? And welcome to the show if you are.
Yes, I'm here. Thank you.
We're going to get right to the chase. We're going to get right to the chase. Hey, that's a phrase I'm going to keep using. If there was one thing, May, that we could help you with, and I say I have a magic wand, I really don't, but I'd like to, and I could wave it and I could fix one problem today. And today we are focusing in the area of mental, emotional type of things. What would be the one thing you would want us to maybe try to help?
I would say obsessive compulsive disorder.
Okay. And I'm going to ask a few questions, and then I'm going to turn it over to Doc over here. But can you tell me maybe the first time you ever noticed that you even were dealing with something like that?
You know, ironically, I didn't even know that my obsessive compulsive disorders were symptoms of anxiety. So I wasn't even aware of that till my early 40s, really. I'm 42. So I just remember whenever I was anxious, I guess the first thing I would do would be I would just start organizing and cleaning and just to get my mind off of it. But really, it's a little compulsive.
I got it.
Rearranging things, right?
Okay.
So
in the 40s, or it sounds like only 2 or 3 years ago, would you really have noticed something like that? I'm going to take you back, as I just have to, before that time period, because there's a chance things have happened. And sometimes they're physical things, not just emotional things. And in my world, I just want to know, have you had any physical injuries to your body prior to the age of 40? Car accidents, falls, traumas, anything significant that you'd be willing to share?
Oh, definitely. I mean, there's a long history of trauma, of family and generational trauma.
But is that physical or is that emotional?
It was neglectful.
Okay, so more in the emotional category. But we're going to get to that. But as far as physical, have you had physical injuries, physical trauma, physical things that have happened?
I've been in car accidents, but nothing that would cause significant trauma, no, to my body. And I've had surgeries, but those were necessary. So I wouldn't say anything that was traumatic to my body, no. Besides I guess that's not true. I was in a domestic violence dispute.
Okay.
So that was traumatic.
Yeah. I find, and I'm not picking on you, but it is kind of my job of the host here to kind of point out some words people use, which is surgeries that were needed. Or necessary surgeries. Like I've had a lot of people had necessary gallbladder surgeries where they removed organs, or necessary hysterectomies. And these are just hard for me to understand, because honestly, God put those organs in your body for a really important reason. And once we remove those and expect that somehow our life's going to be the same, our body's going to be the same, our mind's going to be the same, it doesn't happen. I don't need you to maybe tell me about what the surgeries were. That's not the point. The point is, as people are listening here, physical injuries, surgeries, these type of things, they're not just incidental and non-correlated random activities. It's like just, like you ran into a snowstorm. No, these things accumulate. I always say it's never the bowl of ice cream that causes your toothache. It's the bowls of ice cream, right? Mm-hmm. So we kind of go into the doctors once our tooth is aching, and it's strange. We go, well, gosh, I don't know what happened last week. And the dentist goes, well, holy mackerel, this had nothing to do with last week, right? This is the last 20 years often. So, okay, well, just be aware that sometimes the solutions you find are not going to be only at the counselor or the psychologist. You often need to look at more holistic ways, physical therapy, chiropractic, nutrition, naturopaths, things like that can help your body physically function better. And you'd be maybe shocked and sometimes how the emotional things start to reduce and even sometimes go away. But let me toss it over to Doc. So OCD, I know you've dealt with it. I'm sure.
Yes.
What would you say? Any other information you'd want to get?
So I think with OCD, the big thing is you're right, Maya. It's associated with anxiety, and a lot of times it's when we're feeling out of control and we don't even realize it. It's not because you want to be a control freak, right? And I need to be in control of everything. However, there are certain things in life that we need in order. And when other parts of our life are all over the place, we don't have answers, or we're unsure, or we have physical things going on that we don't know how to manage, we try to take control in other areas. And a lot of times that can become OCD. I'm going to reorganize. Oh, I don't know what to do with this. I don't know where to channel all my energy. I'm going to go clean this or organize that, or wash my hands 4 times because I know then I'm going to be clean and I won't have to worry about germs. Whatever the obsessive compulsive concern is or behavior is, that's usually where that comes from.
Okay. Let me dig a little deeper here, May, if you don't mind. Are you taking any medication?
Yes, I do take medication for anxiety, a very low dose
of
sertraline.
Any other things, though? Again, like often people say, I just take Prilosec, or I just take Tums, or I just take ibuprofen, and they forget those are actually medications. Are you taking anything like that or anything at all consistently?
No, I'm not. Just vitamin D.
Okay, so anxiety medications, and just curiously, have you looked at the side effects of those just yourself? Have you really Googled it or just WebMD'd it? Even they're willing. You haven't?
Are you trying to freak her out?
Yes.
Well,
okay. May, isn't it freaky reading all those side effects?
Oh, absolutely. It was on 50 milligrams, and I said, that's too much. I'm actually getting very manic on 50 milligrams.
Ooh.
Yeah. So my doctor said, okay, just go back to 25.
Yeah, that's good.
I still would encourage anyone to really look into that, because often we start getting these symptoms following the initial symptom, and then we start going in and the doctors don't check the side effects, and we don't really know. When we start interacting one med with the other, no one really knows what's happening, and every body's different and every symptom and side effect is different, but the common ones are there. And if you're noticing that, you got to consider. So, all right, now back to you, Doc. If someone was going to deal with something like this and they didn't take medication, I mean, I get that's where people go because there doesn't seem to be other answers. Are there other answers?
There are other answers. I mean, May, are you in therapy currently?
I was for quite a while, but again, I haven't confronted this.
Right.
It's always about the past. So this specifically, no, I've not been in therapy for.
Okay. So, I always go to, having to talk through all that kind of stuff, but medication is usually pushed until you can come up with different behavioral traits. So I think that's the big thing. So if you do decide to go back to therapy for this for this OCD, then I would really talk to your therapist about what behavioral techniques can I use to change this. So if I start to feel overwhelmed, instead of restacking those bowls 4 times because they don't sit properly and it makes me feel better, what other potential physical activity can I do, right? Your body is, I go back to the central nervous system. Like Dr. Wall was saying, our body will respond right before our emotional side. So your central nervous system will go off the charts, and that's what your anxiety is. It's going off the charts. It's firing like a little volcano. And then the only way to contain it in that moment is to do these things. And so you might go down from a 12 to a 5, but you're going to shoot right back up with something small hits you. So it's learning new behavioral techniques to keep your anxiety lower and start to notice the shift in your body before it hits your brain so that you can stop yourself from those behaviors. And it's doable. It just takes repetitive practice. And I like to call what we like to call, it's fun for us therapists, exposure therapy. So your therapist will make you do something uncomfortable or tell you not to do that, where you have to sit in that discomfort to know that you're strong enough to work through the discomfort. And it's nothing intense, right? It's like not over the top. You're not going to become injured or anything like that, but small steps like that to help with those OCD behaviors.
That's definitely great advice. In fact, at our centers, Mental Health Centers of America, we shockingly, and I say shockingly because if you've ever done a cold plunge, you know that's a bit shocking. But there's a reality is it's actually one of the treatments that we use in the holistic capacities where people, if they can sit in just cold water for 20 seconds and realize that they could do it, they can control their body and they could not die, that actually kind of is like there's a breakthrough that occurs. And so there's something really true to that building some resistance and resilience can really help people find that they have some ability to control or get back under, I guess, control of their emotions.
Yeah. And, you know, if you don't have the opportunity to actually get into a cold plunge, turn your shower on as cold as it goes, just for 10 or 20 seconds and stand in that. I used to do that. I was feeling overwhelmed. I'd do that, stand with my back to it. You got to take a lot of deep breaths and just really control and focus on your breathing. And it's very enlightening about how that can change. So just so you're aware, us counselors need counselors too. And we have to work on our own stuff. And, you know, it's contradictory if I tell you to do one thing and I've never done it before.
That's awesome. Well, all right. I've done the cold shower, but, you know, growing up in Iowa, I've swam in the swimming pools and that's like a cold plunge when you were a kid and you didn't care. But there is one more thought I would ask if May would be willing, because I'm just curious as I am often. May, on the, so to speak, necessary surgeries, do you mind me asking what they were?
Sure. So I've had 3 cesareans.
Okay.
I've had an ovarian cyst removal, and I've had a hernia surgery. Actually, 2 ovarian cyst removals. Okay. One that took out fallopian tube and everything. And then this last one was a hernia surgery, an umbilical hernia.
Gotcha.
Ooh, those are all very traumatic. You know, I was thinking about it, Dr. Wall, you're saying, I know we don't have much more time with May, but really quick, those are traumatic. Your entire organs have to re-find where they're supposed to go, especially after a cesarean, especially after giving birth in general. Everything has to realign. And when you go in and you mess with the female organs, like that's overwhelming. That causes trauma to that area and your body has to heal and everything has to adjust.
100%. Well, I'm going to peel that onion back a little deeper though, because this is a classic scenario that people probably would never have related. So let me back up a minute. How does someone get ovarian cyst? That's the question that starts to arise. And if we're really honest, and anybody in the world of knowing anatomy knows that there's some hormonal imbalances that have to be going on for many, many years that lead to the ovaries just either not releasing the egg and a variation of other things that just lead to these cysts. So the reality is I can tell you, let me, again, I'm gonna go a little further. You've had how many children?
3.
And the first child was when? How long ago?
2006.
And the ovarian cyst occurred after or before that?
The ovarian cyst was in 2009.
So here's what happens, folks. And I'm telling you, this is so classic to the unplugged concept. When you have your first child, did you breastfeed, May?
For about 4 months.
Okay. Most women who breastfeed, or even if they don't breastfeed, because during the 9 months of gestation is when you're actually growing a child. This is a pretty amazing thing. You grow people. You are giving up everything you have inside your body for everything they need. And unfortunately, that is essential fats to create brain tissue and muscle, and fatty tissue, and just all fats get depleted out of every woman. And then if you go breastfeed for 4 months, which don't get me wrong, that's a phenomenal thing to do. And thank God you did it, May, because you are giving your child a future that no one else probably could. But in that area, you get depleted in more essential fats. You know what essential fats are, May?
Not exactly.
Well, you hear the old fish oils, the olive oils, all those things that you kind of hear out there to take essential fats. There's lots of ways to get essential fats, but they're fats that your body need. They're essential for your body to produce hormones. And when your body does not have fats, it will not be able to produce hormones very well. As a result, you then get hormone imbalance. And then next thing you know, you have ovarian problems, and then they take your ovaries out. Next thing you know, you're having other issues. And then pretty soon, and I'm going to just, make this too simple, but it probably could be, next thing you know, you're in anxiety, no CD, because you are dealing not only with the things that Dr. Chase talked about, but your physical body has got hormonal issues. And unless we go back to the roots and find out how to get your hormones a little more balanced and go to look at someone who really understands a typical blood work, you go to your normal OBGYN, they're not going to typically go deep enough to find out where the imbalances really fall. I would really recommend a naturopath or someone that focuses in this field, and we find someone who actually understands hormones. Once we find hormones balanced, then we get, then you got to come up with a plan. But the great news is don't you believe we can come out of this, can't we?
Oh yeah, very much so.
I mean, she's not that deep into it in like 2 or 3 years, which a lot of people come to us and we're like 25 years into these things.
And May, just, I want to give you kudos for working on yourself and taking care of that, and just understanding that your OCD does also come from all that trauma. So all that past work is benefiting you. And I know it's not easy to do it. So kudos to you.
And this is great, and why we have multiple professionals on it, because I surely know just enough to be dangerous sometimes. But I will tell you, there is something physically and hormonally going on that's related. And if we want to get you back to it, I think it's going to combine a couple different ways, and those are 2 ways. Either way, just remember, May and everyone listening, as we are not your doctors.
No, we are not.
We are not. These are just our opinions.
Yes.
And we have a lot of those. My wife says I have way too many.
My husband says the same thing.
Yeah,
they must be friends. But it's true. I think always go back to it. I bring up sleep. I bring up body responses to emotions and hormones. Get it checked. It never hurts to get it checked. Worst case scenario, what? Nothing's wrong. Yeah. And that's good. And then you have a new direction to go.
We have some more stuff exciting to kind of go over, and some perspectives. We're going to draw a little bit more out of Dr. Chase on her especially. May, thank you so much for joining our show today. We appreciate your time and your vulnerability to share with us, so others can listen and others can learn and relate to what you're dealing with. So have a great day today. Be blessed.
Thank you, May.
Thank you. You as well. Thank you.
All right, guys. Well, we're going to take a quick break, and we're going to come back, and we are going to watch a simple little video on a TED Talk. We'll be back in just a moment.
When I was a kid, my mom and I made this deal. I was allowed to take 3 mental health rest days every semester as long as I continued to do well in school. This was because I started my mental health journey when I was only 6 years old. I was always what my grade school teachers would call a worrier, but later on we found out that I have trauma-induced anxiety and clinical depression. This made growing up pretty hard. I was worried about a lot of things that other kids weren't, and school got really overwhelming sometimes. This resulted in a lot of breakdowns, panic attacks. Sometimes I was super productive, and other days I couldn't get anything done. This was all happening during a time when mental health wasn't being talked about as much as it is now, especially youth mental health. Some semesters, I used all of those rest days to the fullest. Others, I didn't need any at all. But the fact that they were always an option is what kept me a happy, healthy, and successful student.
Okay, well, I can understand maybe why that was so popular.
Yes.
TED Talks in general are pretty popular, but I struggle because I can't comprehend how someone at 6 years old can deal with that level of maybe depression or anxiety or maybe just mental health issues. And it seems like, and I could imagine why, it seems like that's happening more often. So how can we get our people to unplug from this concept that mental health is only for maybe the older population or people?
Yeah, I think it's really tough for adults. We're pretty well known for forgetting our younger years and our teenage years, right? Nobody wants to remember when they were a teenager. And our brain is predisposed to shutting little doors as we get older, to kind of forgetting some of those past memories, right? You got a lot of information. We're literally like the filing cabinet in Bruce Almighty that just keeps going and going and going and going. And so there's all that up there. So we don't remember it all. So when your child is going through something like that, unless you're actively aware or kind of noticing the quirks, then it's just, oh, it's a headache, or you're just trying to get out of school. But, as it adds up, as a parent, you start to know your child, right? And you start to see things. Now, she mentioned in here that she had a traumatic childhood. Something happened to her specifically before the age of 6 that caused her to be anxious and to be a worrier. That could have been a family disputes. That could have been, a divorce. It could have been some kind of other trauma that she experienced outside of the home. But, they defined her as a worrier, which is an anxious kiddo. But there's something else there, right? She's going through something else. And I do love that the school and her therapist work together to create these mental health days. A lot of people are like, oh, that's just a pass. It's so your kid can get out of doing stuff. They're just lazy. They want a way around things. Yes, there are kids who do that. But in her case, with whatever happened to her, when she was even younger, it sounds like it was warranted. And like she said, she doesn't use them all the time. It's that ease of knowing that if I'm having a hard day, I don't have to go to school, and I don't have to stress about the fact that I'm going to be behind or somebody's going to judge me for this. I get to sit in that and take care of myself, because if I can't take care of myself now, how am I going to do that when I'm 35? Or how am I going to do that when I have my own kids or go to college or any of the goals that we have as humans? If we don't start early enough, we're not going to be able to be successful to the degree that we want to be.
Well, no doubt that's the secret almost to unplugging anybody's health problem, is that often, again, we have the catastrophe-minded health scenarios where we wait until something really gets bad enough, and then we decide that we're finally going to take the car in, and then the doctor breaks out the black spray paint, gives us a spray over our oil lights, and tells us to keep driving. And then we get to be, old enough that we just run and drop our transmission. So we got to wrap up our show today. It looks like they're turning out the lights on us.
Yeah. What happened?
Yeah.
Who'd we make mad?
We definitely are doing everything I can to not get this show produced. But I can tell you, here's the thing I'm hoping you walk away with, and you can unplug yourself. First off, it's okay. And it often can occur at a younger age than you think for people to have issues like anxiety or depression or signs that maybe they're heading down that road. Mm-hmm. And if you could, the earlier you can identify those and look for solutions, and often you can look for physical traumas that kind of lead your body into these areas, or changes like even pregnancies or surgeries or car accidents or physical things that can throw your body into a physical tailspin. Sometimes it's the accumulation of small traumas, emotional or physical. And often in life, if you just lived life, which everybody here who's lived life, maybe raise your hand, you'll notice that it's kind of tough. It's a little rocky sometimes. The road is a little bumpy. They're not fixing the potholes. And we're often we hit those things hard, and we just wait until our car just can't go any further. So you can't do that, but there are answers, and pharmaceutical is not where we want you to lean at. If there's no other way, and you've tried things like really good counseling, mm-hmm. if you've tried some more holistic perspectives, there are treatments, there's ways to get around some of these things. There are great psychologists that you can see. Dr. Chase, where would they find you, and how can we leave them with a place to go if people are looking for more answers?
If you're looking for more answers, I started my own company last year. It's Black Sheep Behavioral. So you can go ahead and Google me. I'm on Psychology Today. You can just look up my name. I have one other therapist that currently works for me. He's male. So if you're looking for a male therapist, he's fantastic. Chris. But yeah, Black Sheep Behavioral. That's us. We're here for all the black sheeps out there.
All right. Well, thank you so much for being on the show, Doc. I appreciate your time today. Hey, if you're watching the show and you haven't subscribed, please hit the subscribe button. If you haven't shared it, please share it with somebody. We have a mission to get out and reach people, give them solutions, answers, keep them from this chronic pharmaceutical thing that's caused our health to just deteriorate. Please consider helping us grow by sharing this, liking this, subscribing this, and we'll see you on our next show. And thanks for joining us today.
Thanks for having me, Dr. Wall. I appreciate it.
It was my pleasure.